The Faith Research Network is dedicated to developing compassionate care models that focus on enhancing the lives of families through faith-led, system-enabled community support networks. Our health research aims to develop evidence-based social prescribing pathways that connect individuals and families with community health services, aligned with public health. The network collaborates with voluntary, community, faith, and social enterprise organizations and external partners to strengthen institutional capacities and build transformational leadership approaches for improving the collective impact within neighborhoods and local communities. The Faith Research Network is supported by the Academic and Community Health Research Program and National Institute for Health Research.
Hello and welcome. I'm really pleased today we have Yvonne Maye, who is one of 5 trustees at Fibroid Forum UK. Good day, Yvonne.
Good afternoon. Yes, good to be with you.
Yvonne, what are fibroids?
Fibroids are a common growth of the uterus. They're non-cancerous and never turn into cancer normally. And they're not linked to the risk or other types of cancer. Abnormal growths that develop in or on the uterus and range from a size of a grain of rice to as big as a lemon. So we have many women frequently ask the questions about fibroids, what causes fibroids. At this stage, it's unknown, and there's still a lot of research around it trying to identify what is the cause of fibroids.
What are the symptoms associated with fibroids?
There's heavy bleeding, painful, along with prolonged menstrual cycle, which lasts between 2 to 7 days. And that can be a sign of fibroids as well. And it has a lot of economic impact on the woman, especially if you're in employment. And it can cause a lot of issues around work, taking time off work and so forth. And, it can impact your social life as well, because then you're deciding whether to go out with friends or go on holiday. For myself personally, I used to pick periods of the month when I go out or not go out, and my attire as well. What should I wear? But mainly I wore black because of the condition.
Mm-hmm. So when should somebody contact their GP?
Well, if you're experiencing painful periods, lots of bleeding, and also your periods are longer than a normal cycle, immediately you should go to your doctor and ask your GP to investigate.
And if you're not happy, is a second opinion, is that possible?
It is possible, because with the GP, their training, in some cases, not true of all GPs, is limited in gynae issues. Mm-hmm. And if you're not happy with the response, you can also ask for a second opinion. Obviously, your GP will refer you to a specialist, but if you're not happy with the specialist, you can go on and ask for further investigations, because there are specialized centers where they deal with fibroids. Mm-hmm. Your GP may know about it, your consultant may know about it, but that's the best course of action. And it's also useful to do your own research as well, as much as possible.
So what are the available treatment options?
Well, normally, currently, there are a lot more treatments available to women now. So when I had my condition of fibroids, it was mostly myomectomy and hysterectomy, which is a last resort. But now we have embolization, which is less invasive, where they cut off the blood supply to the fibroid. Hysterostopic, which is a resection of the fibroids. And in this procedure, it's a thin telescope called hysterectomy, and it's a small surgical instrument used to remove the fibroids. And then there's the MRI guided procedure, and this is a fairly new technique, but there are other options as well. So when you go for your second opinion, you ask the specialist what other options there are that would suit your condition, because everyone's unique and it may not suit you as an individual.
Okay, so thank you very much for that. Most informative.
Okay, thank you for allowing me to speak.